Your immune system is supposed to protect you. But right now, it might be quietly destroying you from the inside. And the terrifying part? Most people don't find out until serious organ damage has already happened. If you have lupus, rheumatoid arthritis, Sjogren's, or any autoimmune condition, what I'm about to share could genuinely save your life. These are not generic symptoms you've heard before. These are the hidden, easy-to-miss warning signs that mean your immune system has stopped attacking invaders and started attacking you. I've spent years treating patients with autoimmune diseases, and the cases that haunt me most are not the ones who ignored obvious symptoms. They're the ones who mentioned something felt off and were told it was nothing. Today, that stops. 7 signs, real organ damage, and exactly what to do before it's too late. Everyone with an autoimmune disease feels tired. But this is different. This isn't, "I need a nap," tired. This is the kind of exhaustion where climbing a single flight of stairs feels like running a marathon. Where having a conversation drains you completely. Where your mind goes foggy and your body just stops. If you're already being treated and this fatigue is still happening weeks or months later, that is a red flag your doctors cannot afford to ignore. It means the inflammation inside your body is still burning, still active, still doing damage. Don't let anyone brush this off. Push for deeper testing. You deserve answers. You walk into a room and forget why you're there. Words slip away mid-sentence. Focus disappears. Memory starts to go. For people with lupus or Sjogren's disease, this brain fog isn't just stress or aging. It can mean your immune system has crossed a terrifying line and is now targeting your nervous system. Some patients don't just experience forgetfulness. They develop severe depression, crippling anxiety, personality changes. And when they bring this to their doctor, too often they're told, "It's all in your head," which is almost cruelly ironic, because it literally is in their head. The immune system is inflaming the brain itself. Keep a journal. Write down every episode, how often, how severe, how it affects your life, and bring it to every appointment. Imagine sitting down for a meal and the food gets stuck. You cough, you choke. You have to swallow 3 or 4 times just to clear your throat. If this is happening to you, especially if you've been diagnosed with polymyositis or dermatomyositis, this is not a minor inconvenience. This is an emergency. Inflammation is attacking the muscles in your throat, the very muscles that keep food from going into your lungs. And if it goes untreated long enough, permanent swallowing damage, severe lung infections, and hospitalization follow. Call your rheumatologist immediately, same day, because this cannot wait. You wake up with a headache, unlike anything you've felt before. Right at your temples, along your scalp, so painful that brushing your hair becomes unbearable. Then chewing becomes painful, and you stop mid-meal because your jaw locks up. And then your vision goes dark, just for a second. Then it comes back. Then it happens again. This is not just a bad headache. This could be giant cell arteritis, a dangerous inflammation of the blood vessels supplying your eyes and your brain. Without treatment, up to 20% of patients go permanently blind, sometimes in both eyes. But with fast, high-dose steroid treatment, that risk drops below 1%. If you're over 50 and you experience a new severe headache, scalp tenderness, jaw pain, or sudden vision changes, this is a medical emergency, and you need to go now. When did you last think about your breathing? Most of us never do until suddenly climbing the stairs leaves you gasping, or a dry cough shows up that just won't leave. These feel minor and easy to dismiss, probably just allergies. But for people with rheumatoid arthritis, lupus, or Sjogren's, these could be signs that your immune system is silently scarring your lungs. The condition is called interstitial lung disease, and by the time it becomes obvious, the damage may already be permanent. Breathing, something you've done effortlessly your whole life, becomes a daily struggle. Don't wait for it to get worse. Mention any respiratory changes to your doctor, because early detection changes everything. Here is what I tell every young patient I diagnose, even those in their 20s and 30s. If you don't care about your joint pain or your hair loss, care about your heart. Autoimmune inflammation isn't just uncomfortable. It's a fire burning inside your blood vessels, and over time, that fire can quietly devastate your cardiovascular system. If you have rheumatoid arthritis that isn't aggressively treated, your risk of heart attack, heart failure, and stroke can double or even triple at a younger age than you'd ever expect. And these heart attacks don't look like the ones in movies. No dramatic chest clutching, no Hollywood moment. Instead, sudden nausea, stomach pain, overwhelming fatigue, or sometimes no warning at all. If you feel chest pressure, unexplained nausea, sudden sweating, or heart palpitations, get evaluated urgently and do not wait. Out of everything your autoimmune disease can attack, the kidneys may be the most dangerous target of all. Because here's the cruelest part. You can feel completely fine while the damage is happening. Then one morning, you notice your socks leave deep marks on your ankles. Your eyelids look puffy when you wake up. You glance in the bathroom and see foam or bubbles in your urine. Or worse, it's brown or reddish, and your blood pressure has crept up with nobody sure why. These are the quiet signals of kidneys under attack. That inflammation, if it's not stopped, turns into scarring, and scarred kidneys don't filter toxins the way they should. The road ahead becomes a devastating choice between dialysis several times a week or waiting for a transplant. The earlier you catch this, the better your chances of keeping your kidneys functioning for life. Now you know what most people, and even some doctors, miss. But I didn't share this to frighten you. I shared it because knowledge is the most powerful thing you have. The most life-saving diagnoses don't happen because a symptom is textbook obvious. They happen because a patient, just like you, refused to be dismissed. You felt something was wrong, you pushed for answers, and you were right. You are your own best advocate. Don't stop until someone listens.